Bun găsit tuturor, sunt Georgiana Ioniță, iar dumneavoastră urmăriți interviurile DC Medical. Vorbim astăzi cu Farnaz Marzban, Regional Marketing Manager la Boehringer Ingelheim. De aici vom continua interviul în limba engleză. Hello, thank you for accepting our invitation.
Happy to be here.
Respiratory disease have been in the spotlight lately, so our discussion is really useful, I could say. What is the importance of respiratory treatments for Boehringer Ingelheim?
The heritage of Boehringer Ingelheim in developing medicine in respiratory spans over the hundreds of years. 1921, we already had the vision to transform the respiratory areas, the respiratory field. And actually, we are very proud to say we became the market leader in the respiratory field. The focus was always to improve the patient quality of life, make the treatment available for these patients, but also support the physicians, the professionals, the healthcare professionals. Here we are talking about the respiratory diseases like the chronic obstructive pulmonary disease like COPD or pulmonary fibrosis. They are the devastating disease for the patients. At the moment, unfortunately, there is no cure. We can reduce the symptoms, but we cannot cure the patients, unfortunately, not yet. But of course, all of these treatments and research shows that we as the Boehringer Ingelheim are committed to continue to research in this field and make sure that the respiratory patients will receive the best solution for in the future.
I know that the incidence is really dramatic. 1 billion people suffer from these various respiratory diseases worldwide.
That's true. That is it is in respiratory disease, in the whole respiratory disease, we are talking about 1 billion patients. But if you are coming for the pulmonary fibrosis, and we have a disease, idiopathic pulmonary fibrosis, here we are talking about 3 million people that are affected by this disease. In the systemic sclerosis with interstitial lung disease, we are talking about 2.5 million people. And pulmonary fibrosis, our last actually approval that we have recently, we are talking about 5 million people that are affected.
Are Romanian patients having access to all your respiratory drugs in the Europe zone?
Yes, fortunately, yes. I can say yes to these questions. It was a very good relationship and collaboration between the Boehringer Ingelheim in Romania with the authorities. And that's why the patient, they have access to this for these treatments. But what we should keep also in the mind is the whole topic around the reimbursement and market access in European countries. It is this reimbursement and market access is still a very hot topic in European countries. In April, it was an annual report from the European Federation of Pharmaceutical Industry and Association. And we saw here there were 39 European countries involved, and I think it was about 160 innovative medicine. And we saw the time to get the treatment from the reimbursement until to get the treatment are still very different among the European countries. It improved immensely in this area. We have now about 511 days from the beginning until they get the approval and they get the treatment to the patients. In comparison, in Germany we are talking about 33 days. In Romania, we are talking about 899 days. You see, there is a big difference between European countries, and in Romania we still have a very hot topic. But what does it mean for us? It means there is still lots of things to do in Romania. Of course, there are very barriers regarding the pricing, regarding the budget. But we are very sure that the pharmaceutical industry in Romania, they are very committed to have a collaboration with the authorities and to find the best solution for the patient and to make this treatment very soon available to the patients.
Are you working closely with the Romanian MDs on this respiratory?
Yes, the BI is very much established. It's very well established in Romania. We have a very good collaboration with the physicians. And it is also very much needed, because if you want to have a treatment for the patients, you need also to make sure that you understand their needs. And to understand the needs of the patient, you need to understand also to have a close collaboration with the physician and with the patients. And that is one of the first and most important start points, and to make sure that the patient receives the right treatment. We do have a very good collaboration with the physicians here, and our aim is also to establish the partnerships with the society, like the Romanian Pulmonology Society, and also with the patients' society associations. And we as the Boehringer Ingelheim is also very much keen to support the young physicians and make them also this education in the respiratory field available, and which means that we are providing different kind of trainings in the respiratory field. Also the Romanian colleagues, they are organizing the road shows in the different Romanian cities, just to make sure that we are establishing that we discuss the multidisciplinary discussions or setting, which is very much important to diagnose the pulmonary fibrosis. Talking about the pulmonary fibrosis, maybe I forgot to mention that it is a very complex condition, and to make sure that we have the right treatment and right diagnosis, we need to involve the different kind of physicians. They need to sit together to discuss and to have the right diagnosis, and then also the tailored treatment for the patients. This kind of setting is still not established everywhere in European countries, including Romania. That means in Romania, we see the need to establish this or to optimize the collaboration between the different kind of physicians and establish this multidisciplinary setting, and to make sure that the patient, they get the treatment on the right time. Because for the ILDs, it is very crucial to have the right treatment to the right patient at the right time. And in Romania, what we also see that a late diagnosis is one of the major topics. I mean, the patient, they are going late to the pulmonologist, but also on the pulmonologist level, we see that the late diagnosis, and also they are starting also with the treatment late, which is not very much optimized, not good for this kind of patients. That means we need to make sure that they get the treatment as early as possible.
You mentioned that we need some more specialists to collaborate and work together. Which specialist from?
We are talking about primarily we are talking about the pulmonologist and the radiologist. But of course, for the new indications that we have, or the condition for pulmonary fibrosis, we have also the rheumatologists. They are one of the target groups. Sometimes the internist. It depends on the hospitals and the situation that we need to bring different kind of physicians. But the major target groups are the pulmonologist, rheumatologist, and radiologist.
As you mentioned, the waiting time that can be really long.
Yes.
What does that mean for the patient life or health?
I think for this kind of in this kind of situation, you should always think about your family members. Imagine, because this disease are mainly for the elderly people, and imagine one of the very close family member has this disease. The most important part is to make sure that this person get the diagnosis early as possible and get the treatment. As I said before, we are just at the moment, with the treatment option that we have, we are reducing the symptoms and the risk, but we are not curing the patients. That means as early as possible to bring this treatment to the patient is very important. Every single month is crucial. That's why if my mom has this disease, I would do everything to make sure that she got the diagnosis at the right time and then had also the treatment as soon as possible. Because late treatment means also the effect of the treatment will be reduced.
You recently launched a new treatment for pulmonary fibrosis. What is this role? What is the role of this new treatment in your overall plans?
The pulmonary fibrosis is one of the strategic, for Boehringer Ingelheim, is a strategic therapy area. Living with fibrotic diseases impact the patient life emotionally and physically. And this patient needs also a broader spectrum of medical services. And as I mentioned actually before, that we are talking about the multidisciplinary setting. And to bring these patients together, these physicians together. And that's why the plan is just to make sure that we have the patient receive the treatment as early as possible, and also the proper diagnosis. And what is our vision to make sure that we have a treatment that not reducing the risk and symptoms, but also curing the patient, that we can put an end to this devastating and life-threatening disease.
That is the main goal, the main plan for...
Yes, for Boehringer Ingelheim.
Okay, thank you so much for all these details. If you have something for our finish line to put here, this is the time.
Mm-hmm. Yes, first of all, thank you for having me here. I think it is very important to make sure that also this disease in pulmonary fibrosis is still not known as it is. I mean, it is, if you are talking about the cancer, everyone knows. If you say that it is about lung cancer, everybody knows what is the lung cancer. Pulmonary fibrosis, unfortunately, is not as known as lung cancer, but is as deadly as lung cancer. That means, as I mentioned before, unfortunately, we don't have any cure for these patients. That's why it's very crucial to do the early diagnosis and make sure that these patients get the early treatment as soon as possible. As soon as they have the diagnosis, this patient needs to be treated. Otherwise, the disease will be worsened, and also the quality of life will be not given to these patients.
Thank you so much, Farnaz. Iar dumneavoastră vă mulțumim că ne-ați urmărit și ne vedem data viitoare.